So I would love to hear about like what are some of the best times for a patient to come in for pelvic floor treatment and what are some of the benefits of receiving care?
Basically, the area of pelvic floor physical therapy, when you hear that term, it is a physical therapist that specializes in either pregnancy or postpartum, men's pelvic health, which we won't get into a ton on this podcast, or some sort of pelvic pain condition. And so those are the three major areas that we can help people with.
Mhm.
But now if you think about pelvic pain conditions. Now we're talking about things like painful periods and endometriosis and bladder conditions and bladder dysfunctions and incontinence when you're running or doing a sport or gymnastics or something like that. And so we can see folks from at Pelvic Sanity, we have age ranges from like 14 or 15 kids in high school that are having some of these more menstrual health related problems,
Mhm.
or problems with when they're playing their sport or being active, all the way until like postmenopausal women that are still trying to be active but maybe having pain with intercourse, osteoporosis, those things like that. So the women's health specialty is really pretty broad. Um, but those are some of the major just common big areas that we can treat. And so the other way to look at it is that we can our pelvic floor muscles are areas of our muscles in the pelvis that control bladder, bowel, sexual functioning, and some orthopedic things like with your back and your tailbone and your hip. So if you have any issues around peeing, pooping, sex, or basically things you don't want to talk about at the dinner table,
Sure.
um, and maybe a little bit of like low back pain that maybe hasn't
Mhm.
gotten better with the traditional route of, ignore it for a while, just take some ibuprofen,
Right.
or, some of the, orthopedic physical therapy things, then sometimes if you have any one of those other things, or you've had a baby before, or you're in perimenopause, then those are some of the areas that we can also address because sometimes those things can be coming from your pelvic floor, which is why you haven't seen success during some of the more like mainstream routes of getting rehab.